Good morning. It is a beautiful day in the land of Israel, March 29th, 2020, the start of another week, the fourth day of Nisan, 5780. And I managed to grab a few minutes between a very busy schedule with my very own mayor of Efrat, Mayor Oded Revivi, who is going to share with us for the next few minutes the challenges, the unexpected challenges of dealing as a mayor in a situation that we'd have no precedent for. So first of all, Oded, thanks so much for joining me this morning. I know you have a staff meeting in a few minutes and you go to the library every day and read to the kids on Zoom, the kids in Efrat. So I really appreciate the time. So start of a new week. What's going on?
Well, it's a bit funny that you say it's a starting of a new week because I don't quite recall that we ended the last week. If there wasn't Shabbat, it's almost like a snow event, that it's an ongoing event, that the challenges just keep on coming as the minutes or as the hours go by. There's no differentiation whether it's a weekend, Shabbat, Sunday, or preparing for Chag. We thought in our house that we'll be this year the most prepared for Pesach because everybody's at home and we'll have a lot of time to actually clean the house and get all the things that we wanted to do. But the truth of the matter is that I personally find myself working way harder because it's just ongoing. Friday night, 5 minutes after lighting candles, I get a notification that we've got another 2 positive checks in Efrat. So you just leave everything and you now start dealing with these 2 new people who have been identified as sick and all the implications. So it's an ongoing challenge. It's not really a beginning of a new week, even though it is Sunday morning. And definitely challenging times, completely unexpected. And if you put on top of that all the headlines, all the events that are happening within the political sphere, within Israeli politics, so there's really never a dull moment as to what's happening here at the moment.
That's for sure. That's what I say to people. A lot goes on in Israel. No one ever dies of boredom, though. That is not even on the list of dangers. So among the things that has put Efrat on the map, and you've worked very hard in the last few years to put Efrat on the map in many ways as a green city, as a city that's really got a top educational system here in Gush Etzion. What you didn't probably want is to see Efrat very high on the list of places in Israel with people who have the virus. So what happened here in Efrat that caused that to put us on that list so high?
Well, there is a bit of injustice with that list, and I'll tell you why. What happened was, when we started hearing about this virus, everybody was puzzled, everybody was unaware as to how to deal with it and what is supposed to happen. Within, I think, a day or two since the virus actually hitting us, knocked on my door a neighbor of yours, Harow Adler, and he comes to me and he says to me the following thing. He says, Oded, you have to understand, people who feel sick, who have the symptoms, they call the Ministry of Health, they try to convince them that they're eligible to have the test, then gets an order to go and actually proceed the test on that specific individual, and then they take it to the lab, they wait for the results, and then the results come back to the actual person who was suffering.
I think we should add that Harow Adler is one of the top paramedics in Magen David Adom and has been for many years. So if he has information, he has information.
I believe you know him personally since he was running around in diapers. So you've got a more longer reputation to actually.
He's one of the kids that wasn't one of my kids, but was in my house a lot. Yes, exactly.
So basically, he said to me, Oded, I've got an idea. Let's train 10 volunteers by Magen David to actually be able to do those tests. I need from you a car that will able to maneuver the volunteers, and I need a freezer to keep the kits in so they'll be on standby. I said, Aaron, it makes sense. No problem, you've got it. Within 12 hours, we actually trained those 10 volunteers. We designated a car for them. At the end of the day, we didn't need to designate a freezer because we weren't given any kits to actually stay in Efrat. But with this unit, what we managed to do is actually proceed the tests way quicker than any city in Israel. So even though Efrat has got today 13,000 residents, 14,000 residents, the amount of tests that we were able to carry out was almost the equivalent number of a city which is 100 times bigger than us, Jerusalem. So when the results came out, all of a sudden everybody was shocked. Wow, how come Efrat is number one on the list? It's not that people here were reckless. It's not that people here took the instructions. It is because we managed to test the people quicker. We managed to put more people in quarantine quicker. And that, in a way, thanks to Aaron Adler and those volunteers, we actually managed to, I would say, oppress the pace of people catching the virus. And I saw him Friday, and he says to me, look at the statistics. Wow, what would have happened here if we wouldn't have had that protocol here? And that's why we hit the charts number one. But we have a reason to explain it. And you know what? Coming back to your question, yes, we're proud to be the number one city, because at the end of the day, it means that we did here something that afterwards was adopted in a way by Magen David Adom. They didn't actually train those volunteers, but they invented the drive-through test places where people who don't feel well, they actually come into a drive-through, they get tested, and then they get the results. So we had a home delivery. The Ministry of Health imitated it into a drive-through. But at the end of the day, it's all mechanisms as to how to get the tests done quicker.
All right. So as you know, my husband's a physician. He gets the updates from the Ministry of Health every single morning what's going on. And that's exactly why the statistics are skewed, because there are a lot of people who are sick who don't know they're sick. And because not enough testing's been done. And so what you're saying makes a lot of sense, that Efrat did a lot of testing, and therefore we've revealed who really is sick, while in most of the country, there is kind of a ticking, especially in certain neighborhoods, there's kind of a ticking thing happening where we're only going to know. I understand also in places like East Jerusalem, among the Arab population, in places like Bnei Brak, people are not willing to say that they're sick. There's like a social stigma. And what we have here in Efrat is people not just willing to say that they're sick, but they're giving out their names because they want to make sure that anybody who saw them or had anything to do with them knows that they were sick and that, you know, they should go into quarantine to be careful, which is pretty outstanding. I don't think everybody would do that in every town.
That is also one of the things that we were the leading cities to actually do, because when we understood that people are getting positive results, nobody knows that information. The answer is given directly to the person who was tested. Because of a privacy policy, we are not revealed to that information. And then we started asking those people who we knew through different mechanisms that we have. About a year and a half ago, we actually set special teams in every neighborhood of volunteers to help in a case of a crisis. We didn't anticipate that this will be the crisis that we'll be having, but they became helpful, these teams of volunteers in every single neighborhood, in order to convey information, but then also to receive information. And they started reporting, listen, this and this came back to the neighborhood and he's been identified sick. So we use this connection and we ask those people to sign a disclosure that they are giving up their privacy. They're willing to put out their name publicly, but we went a stage forward. We actually trained, again, another group of volunteers to do questioning to those people who were identified as sick in order to publish their route as to where their whereabouts were. Now, again, because we realized that the Ministry of Health was collapsing under pressure, they didn't have the time to publish the routes. They were very efficient in the first 10, 15 people who are diagnosed sick. But when it became over 100, you saw that it takes 3-4 days until you actually get the routes of the people. So we decided that last Friday morning, by Adlakat Nerot, by the time Shabbat came in, we had already the lists of all 40 people who were sick. We had their routes. We published it on the website, which I don't know how effective it is, because at the end of the day, we understand that the virus can be anywhere. But it was another anchor of certainty that people can say, oh, there's somebody who's managing what's happening here. There's somebody who's questioning it. There's somebody who's giving out information. And even if it's irrelevant information, what we saw that it does to the general public was extremely efficient. Now, these two protocols that we have invented, more or less, in Efrat, were 2 days later adopted by the Ministry of Interior. They took a document that we wrote, which was about a 7-page sheet of different lessons and protocols that we've invented, and they basically sent it out to the whole country, to all the different cities, towns, and saying, follow this protocol. We widely suggest and advise, it makes sense. And sure enough, last week, if we weren't having enough on our plate, both me and Yuda Schweiger, the CEO of the council, were getting phone calls from all over the country of different mayors. How did you do that? What is this? Can we have your disclosure of information, what you wrote down? And in that respect, there was a lot of satisfaction seeing other people following in our footsteps. So again, to your question, we were leading also in that.
So first of all, I'm very proud of that. But also, it's something I see that's very Israeli, that in a time of crisis, let's say a war, where sometimes the leadership is overwhelmed or isn't doing necessarily what should be done because they've got so much going on, we have the little people doing it. And you're seeing it all over Israel, the laboratories, the different army units. I found out one of the things that came out a couple of days ago is that Israel is developing respirators from very simple parts, respirators that can be put together quickly. And I knew about that a couple of days ago because the neighbor of one of my sons is the head of that army unit, that intelligence unit, and his guys have been working on it. So what we're seeing is a lot of initiatives that are happening all over Israel. Maybe because some of the usual bureaucracy has been kicked aside because no one's got time for that anymore. And the inventiveness and the creativity and the need to solve problems that is like hardwired into us Israelis, I think you're seeing coming out in all kinds of ways. And it's fantastic that on the level of the mayors, you're able to take the burden off the national government and figure out what's happening here. But on the day-to-day, on the things that a mayor has to do haven't gone away just because we have sick people. So usually before Passover, for example, the garbage cans are overflowing anyhow before Passover because everybody is cleaning their house and getting ready. So how are you managing to keep the city clean? How are you managing to keep the city functioning, given the fact also that a lot of the people that work in Efrat are Arab neighbors, people who live in Bethlehem, people who live in the villages around here, have a lot of work that they do in Efrat, and many of them are not being allowed in at all. Perhaps none of them are being allowed in, also on the building sites. So that you have a lack of workers, you have a lot of pressure. How are you coping with all of these things leading up to a holiday, which is going to come no matter what? Pesach is going to be in 10 days.
So you're absolutely right. And the challenges are not finishing because if you mentioned cleaning the houses, just imagine a household that both parents are sick. Who is going to take the garbage or the trash out? So we had to actually get a list of volunteers that they do around 9 o'clock in the morning. All the households where both parents are sick and nobody can take the garbage out, they actually go and collect the garbage from those people. We have asked people not to throw out things which can be postponed. Usually we see Erev Pesach, people throwing out all their old furniture, all the
barbecues, right? Hold the barbecue in your backyard. Nothing's going to happen. It'll rust a little more. Yeah.
We did ask people not to take out garbage that's not necessary, to try and minimize the things that they're taking out. The Arab workers is definitely a challenge because you mentioned the city of Bethlehem. The city of Bethlehem was the #1 city with the most amount of people identified sick. Before in Israel, we even understood that anything was happening.
I'm looking at it right now outside my window, yes.
And Efrat is bordering the city of Bethlehem, so the tension definitely came much higher. That's why the military and the Ministry of Defense put the whole city of Bethlehem under siege before there were any sanctions against the Israeli public. Now, that's challenging because in some of our supermarkets, we have Arab workers that Bethlehem is their hometown, not necessarily that they live there, but they can live in a village surrounding it and they go in and out. And all these dilemmas raise questions as to how you're going to allow them or not allow them to come into action, to contact with our residents. Now, it's very easy to say, oh, don't allow them to mix. But then when you understand, just like you said, that our old garbage system is based on Arab workers, our building sites are based on Arab workers, the challenge becomes much higher. So, for example, Erev Pesach, we used to have big bins that were basically put out just for burning the chametz. This year, we understand we're not going to be able to do that. Number one, people are not supposed to congregate around a specific area. Number two, there won't be anyone who will be able to take it out between the time that we stop burning the chametz and that the festival comes in. So we got Rav Riskin to actually write a psak halacha that people will only have a small amount of chametz that they will flush down the toilet, and by that they will basically do burning the chametz. So it's an ongoing challenge on different spheres, whether it's practicalities of running the city, moral issues as to how you treat the public, and even halachic issues that you have to get all circles involved in order to come out with something which makes sense for the individual as to how his life is supposed to carry on.
Yeah, well, you mentioned halakha, and you mentioned the rabbis. So there were minyanim, even though the rabbi said that there shouldn't be minyanim. You normally people pray in a quorum of 10 men. But I went outside my 100 meters on Shabbat, and there were at least 2 minyanim going on in the street, just in my neighborhood. And people were staying very far apart. They were on their porches. They were like facing apartment buildings, and people were on their porches. But people do feel a need. There is kind of a conflict here because on the one hand, we're being told to not have these prayer services because people can very much spread the virus in the prayer services. And the synagogues were one of the loci for this, I think that's the word, for the virus spreading. On the other hand, especially in a time of crisis, people do feel a need to pray and to feel that there's a bigger picture going on here and to connect in that way. And so I can see the tension. So my husband has not been going out to these minyanim, but he told me that he misses going to synagogue. It's something that really anchored his day in the morning, and it's hard for him. And he's not, and he's not the most social person, because it's not because of that. There is something in having structure, and this is a basic thing that's been taken away. And even though the rabbis are saying don't do it, there are still some people doing it. And there are also halachic issues that are coming up if somebody passes away, not even from the virus, but just passes away from old age, not surrounded, sadly, by children and grandchildren because we have to stay away. What do you do with the body? Normally, there's a whole procedure for taking care of the person. But let's say they did pass away from the virus, or people are together, or other things, going to the ritual baths, or the women, can the women go? Is this a place? So you're involved not just in the administration of the town, but in a lot of different side things that are happening here that are no less important.
I would add even more. I think all the list that you've mentioned is definitely all very good and valid examples. But there's one even bigger challenge, and that is human nature. At the end of the day, we're herded creatures. We might like to have our own property and close it behind the door, but at the end of the day, there is a sense of community. We like to be part of something. You said it's the bigger picture, but it's more than a bigger picture. We like to be connected to others who we can share the same issues. Now, you see it even in big cities like Manhattan, that you would say, oh, everybody's running around and rushing to his job. But at the end of the day, they're proud of being people who live in that dynamic city. So a place like Efrat, which has always been torn between being a city where there's no acceptance committee and there's no really sense of a united community, and on the other hand, because of its history, because of what Riskin did when it was set up, because of the incredible individuals that gathered up here, there was always a very strong sense of community. Now, in a time of a crisis, people want assistance from their peers. And even the social workers, they're not allowed to go and knock on doors of senior citizens and see how you're doing today. Now, that is a major challenge on the human nature as to how you take it from the normal habits of shaking hands and you say to people, stop shaking hands, keep your distance, keep apart from one another. And I think all the list of things that you've mentioned are all examples of that major tension that this virus has hit us, that we were never prepared. Every time we were preparing for something, we said, let's show unity, let's show solidarity, let's gather up for a tefillah. Now, you're not allowed to do any of those things, and that's why more and more people are looking for answers. How do we overcome this time, even though it might not be as scary as the media puts it out to be, but the major challenge is, how do we change the human nature in coping in such a crisis?
And then you have people who have ongoing situations, for example, a child with special needs or somebody who's sick, like immunotherapy. I mean, you have people, and my husband was telling me just some of the cases of his patients. You have people who have diseases and they're immunosuppressed on a day-to-day basis because of whatever it is they have. And now they're more susceptible to getting sick. Or people with kids with special needs who are now home. All those programs are closed. So it's one thing to have, a typical 4-year-old bouncing off the wall. But what if you have a kid who really has behavioral issues, who needs that, who is now cooped up in the house? And I know, and I, thank God, am healthy. And it's very, very hard for me to be cooped up in the house. I love going out. I love walking. And so there are so many things going on here. What are your social workers? Are they able to at least call people, the psychologists, Has that whole system just been also put on hold?
Completely not. It just had to adopt to the new rules and regulations. Cases didn't resolve themselves. Cases didn't become any easier. You've listed issues of special needs and people who are sick, and now they've got a less strong immune system. But just imagine a family which unfortunately is going through a divorce process, or there is joint custody. Now, who is going to communicate between the two people who just had a big fight? It ended up in a court verdict, and now somebody needs to look over who is transferring the kid from one house to another house. Now, just imagine, I can make things even complicated. One of the split parents is also been identified as a positive carrier. Now, he wants to see his kids, but he's in quarantine. Now, that means that the other spouse is going to have more days or more hours of seeing the kids. Now, you can just imagine what the snowball that builds up into. The social workers are in the middle of it, and even not having all that complexity, just dealing with the day-to-day issues, with not being able to actually sit with the people, show empathy, show sympathy. That is a major challenge that they're trying to build new skills as to how to cope in this time.
And how about helping people who've lost their jobs? Because I'm sure you have quite a few people who now, I mean, I lost my job as a tour guide, but I know there's people who are the heads of households who no longer have work. And here you are coming up to a holiday season as well. Is there some kind of system in place to at least help give a loan or help people out with food distribution or something?
So I have to admit, I think that's one of the issues that hasn't been addressed yet properly. We're talking about amounts of people which are completely ununderstandable. Israel was all the time showing off with having a one-digit figure of unemployment, most of the time under 5%, which was one of the major things that Netanyahu was praising about the economical system. We've now crossed the 500,000 people which are unemployed. We're climbing up to 20% of unemployed people. That is a major part of the population. Now, the challenge is that you can't really say, oh, so let the business owners deal with their workers, because they all have gone to shutdown. So their source of income is not carrying on. So they don't have a supply of income funds that they can distribute salaries. So a lot of the people have been put into unemployment slots. And I understand that that is one of the major concerns which are on the government's table at the moment, to see how they actually manage it and challenge it. On a local level, we've always got the generosity of some very wealthy individuals who are helping out, giving out charity. But even they, I have to say, seeing this reality, not knowing as to where it's going, are also taking a step back, because they're saying, we can't guarantee that our sources will last us for as long as we want. So it's a vicious circle, and we'll have to see how long it carries out for. And hopefully the government will come out with some financial scheme that everybody will be able to see the light at the end of the tunnel.
So a problem that Israel has, that I would imagine virtually no other Western country has, is we are also very intertwined in a not great neighborhood on a regular day here in the Middle East. And we mentioned Bethlehem and some of the villages around here in the sense of many of the workers, we provide them a lot of the employment that the Palestinian Authority doesn't. And many of the workers, even in the supermarkets, the regional supermarkets, and there's a tremendous integration. However, there's also a tremendous tension. They still are under the Palestinian Authority. These are still places where we have to have security, because terrorism doesn't end just because there is a health crisis. And it could be that their tension is building up even more as they lose their jobs, as the Palestinian Authority doesn't manage the crisis as they should. So what's going on in terms of a mayor? You still have our Kitat Kananut. We still have our guys, the volunteer people who protect Efrat on any day, and also the army. So how is this all integrating, or this has kind of been put on the back burner for now, or it can't be?
Nothing is put on hold, and that's why I said that I find myself working even harder. When the virus broke out, I did actually start having talks with the commanders of the army in this region. At first, I was scared as to, because of what we heard about Bethlehem, what safety precautions were taken with Bethlehem, that they won't spread the virus. So I was comforted that they actually said that in the Palestinian Authority, maybe not like within the Israeli government, the measurements are held way more strictly. If somebody is supposed to be in quarantine and he's not being in quarantine, he gets heavily punished. He's been put behind bars. The sanctions are way stricter, a bit like what we saw happening in China. But then when people started losing their jobs, immediately it crossed my mind, because they don't have a mentality like we have, putting money aside, saving it for a rainy day. Their mannerism, their way of life is they eat out of their hands. Whatever they earn, they go immediately and they spend it out. Now, if that's a scenario and they're not getting paid for a week, 2 weeks, 3 weeks, they will start walking around looking for food. Now, if there isn't a solid border, there isn't, the safety measurements are based on some sort of mannerism, all of a sudden you have masses of people starting to look for food. That can become a safety hazard. So I was again assured that the army is actually having plans to see how to protect the safety of its residents. But then I carried on the challenge and I said, but how are you actually protecting the soldiers from not getting the virus? Because my son, for example, is in a tank unit. So if, let's say, 20% of his unit get sick with the virus, and all those who get sick with the virus are tank drivers, that means that the unit of tanks can't actually go to the border and protect the borders of Israel. So the army did take very strict precautions, basically didn't allow any of the soldiers to go out for at least 28 days, took all the soldiers out of the bases. They're eating out of emergency food kits, which means that they're not coming across fresh food, to try and isolate them as much as possible from contact with society. How long can that last for? I don't know, but these are definitely challenging times that we have to think of questions that we never thought before about.
So it occurred to me, I remembered that I think it was 2006, the Second Lebanon War, and you yourself a commander in the tank corps, if I'm not mistaken, and you ate at my house for lunch on Shabbat. You had gotten out for a few days, essentially to attend funerals, if I'm not mistaken, of your soldiers. And then it was on a Friday, and so you stayed out for Shabbat to be with your family, and you came to us for lunch. And you were telling us some of the crazy stories that were happening there. And one of them had to do with llamas. That, well, maybe you tell it, because it would just occur to me that sometimes people think out of the box, but it doesn't always work. So just to inject, I don't know if it's humorous, but it's definitely not something my listeners would expect to hear. The llama story.
Basically, again, Lebanon is a hilly area with steep mountains. The Hezbollah put out mines and all sorts of different bombs underneath all the roads and the paths, which made it impossible for the convoys to go and give supply to whoever was supposed to get the supply. And what one of the commanders thought, he said, okay, let's overcome them, and we'll put the supplies on llamas, which have got the capability of carrying very heavy loads, and they will just bring the supplies to the units. And it seemed like a very logical, a very sensible, out-of-the-box idea. And they did a drill, and they loaded on the llamas all the supplies that they were supposed to do, and they started making sure that the llamas can go in a convoy and everything is controlled, and it seemed like an amazing idea. Just nobody actually tested what happens when a llama hears a bomb falling next to it. And sure enough, the first convoy of llamas go on track. One of them steps on a mine, never mind what happened to her, which we don't want to elaborate about, but all the rest of the llamas just starting running in all different directions, taking the supply to different places that we haven't found up until today. Now, I'm not criticizing the idea. It sounded like a great idea.
The llama unit. It was an attempt. Yes.
But what it is, when we face challenges that we don't know how to deal with, we don't know what experiment will actually succeed. People are now printing in 3-dimension prints resuscitators. Like, there are different ideas coming from different directions. Whatever will work will be the cure, will be the major aid to assist us with this challenging time. And we need to think out of the, come with new ideas and hope that one of them will be the breaking solution.
Okay, well, I have no doubt that Israel is going to be at the forefront of helping the world, whether it's with a vaccine or with coming up with easy to build respirators, whatever it is. We have a phenomenal population here. And in Efrat, no less. With some of, I think, the greatest people in Israel, I think, live in this little town. And I think we're going to see great things from here. And I'm going to let you go because I know you've got a lot to do today. So Mayor Oded Revivi of Efrat, thank you so much for giving me some of your time. Which means a little less sleeping time. Not that you're probably doing very much of that these days. And we just hope that all of us, the entire world, overcomes this as soon as possible, that we learn some big lessons from it. Don't just go back to business as usual, but some of the things that we see that we miss now to integrate more into our lives. Like, as you were saying, the social elements, and that we don't take anything for granted, as I know that you don't. So thank you so much. Shavua Tov, Chag Sameach. And thank you for everything that you're doing.
Thank you, and I agree with all the wishes that you've said. I think it's a great learning time, a great period to actually look inside what we may be neglected, what we need to strengthen for the day after, and please God will come out of it stronger and healthier. Have a Shavua Tov.
Bezrat Hashem. Thank you so much. All right, everyone. That was great. Wow, I'm so glad that he was able to give some time, give a little bit of a kind of a glimpse on what the day-to-day is like now for the mayors. He's a mayor. Efrat has about, as he said, about 14,000 people here in Gush Etzion in the Judean Hills. There are other mayors, of course, of very large towns. There are heads of councils and kibbutzim and on small communities. Everybody with their own challenges, depending on where they are. Of course, the people who are out on the Gaza envelope, that hasn't stopped. That hasn't stopped with its lunacy just because. There was, I think, Friday night, there was something that was shot out of Gaza. So we'd like to think that everybody's concentrating on different things, but we might be surprised. So Israel has its challenges, as the whole world does. Thank God the hospitals seem to be coping with the number of cases, and we seem to be doing, because of this putting people, telling people really not to go anywhere that they don't have to go. We seem to be doing the famous flattening the curve, but only time will tell. And all we can do really is wish for this pandemic to die out very, very quickly. But who knows what'll be. From day to day, everything is changing and the numbers are going up, and everyone whoever's sick should just be well as soon as possible, and we should find a cure for this. But also, it's an interesting thing to see that the planet in some ways is taking a breath, right? We've got dolphins back in the canals of Venice, and we have much less pollution, and we have fewer car accidents because people aren't on the road. So if you want to look at the silver lining to this, there's always a silver lining, but it is definitely stressful, and some people are rising to the occasion. They do well with a slower pace. One of my good friends, she's actually enjoying this, not the reason for this, obviously, but enjoying the slower pace and the people not traveling so much and the kids at home. She has older kids, not 4-year-olds who are crayoning on the wall. So people are finding the good in this, but it's also very, very stressful. And for people who have already difficulty coping with stress or have had old traumas. I got a letter from somebody who has had a traumatic life, and a lot of things that they have overcome, and don't have patience for a lot of the complaining and a lot of the whining that they said they're seeing because people can't go out. They said, "Oh my God, I had such a tough life. This is nothing." And so that's good also, but I think we also have to be careful to not judge each other. Everybody copes with things in a different way. For some people, this brings out strength. For some people, this touches on more difficult things that have happened to them, as we spoke about last week with Naomi Baum. And so I think it's important, as in any situation in our lives, to not judge, to see what we can do to make our own little world better, to help the people that are around us, to volunteer if we can with others, if that's at all possible, in any way that we can do that, to reach out. But this is definitely something global, and that makes it different than a local earthquake or fires in Australia or whatever it is, where we read about it in the paper, and unless it's affecting us immediately, so we send in some money and we hope for the best and then we move on. But this is something that really all of mankind is dealing with at the same time, which gives a lot of place for thinking about what exactly is going on here. Please don't ask me for answers. I haven't a clue. I really don't. And I'm just going to keep on doing what I can. And I'm happy for people to reach out to me. You can always write to me, eve@thelandofisrael.com. If you're bored or you have a lot to do, you have a lot of time on your hands, I have some tremendous podcasts, some tremendous interviews that I've done over the years that you can find on my website to help pass the time. With some really terrific minds on all levels, archaeology and philosophy and Torah and just you name it, a really eclectic group of people that I've been honored to interview over the years. So that's at my website, www.eveharow.com. Obviously, I'm not going anywhere, not for the near future. Was supposed to be in London in early May at a weekend about Israel, speaking about Israel to the Jewish community. And of course, got the official letter canceling that a couple of days ago, which was, of course, understood. And so having to rethink and redirect. And I guess that's good. I was setting quite a pace in the last month before this hit. And so to some degree, I've had to learn to not because I wanted to, but have had to learn to slow down. And I guess somewhere in there, that's good for me. We'll figure it out at some points. Anyway, I just hope that all of you listening are well and are following the restrictions of wherever that you are living, so that, because this isn't just about us, and even if you are well, this is about possibly and unknowingly getting other people sick. And how terrible would we feel if we did that? So even though this is hard, and even though a lot of us feel good, like I'm staying away from my grandchildren, which is incredibly difficult for me, but they're worried about getting me sick, and I'm worried about getting them sick. And so we're keeping our distance, and that, I guess, will make the hugs that I will get in hopefully just a few days' time, but more realistically, probably a few weeks' time, all that much sweeter. So thanks again to Ben and to Tabitha for continuing to put this out to the Land of Israel Network. Very much appreciated, this platform. That's it for now. Take care, everybody. Eve Harow, Rejuvenation on the Land of Israel Network. Take care, everyone. Goodbye for now.
They're empty illusions. And the more idols we have and the greater faith we place in them, the more painful all of this will be.
We are living in unprecedented times. What the future holds is unknown.
I got 6 kids that I gotta feed, dress, brush their teeth, get their bags packed. We gotta get them in the car. And now in the morning we wake up and we're not going anywhere.
Why is this happening? Join Ari Abramowitz and Jeremy Gimpel on Israel Inspired as they discuss their different views on the current world situation and how to navigate these turbulent waters.
Maybe you're right, maybe you're not. You haven't received a prophecy of what will be. Maybe they should just prepare themselves for the worst and hope for the best. I have messages that I think are more in tune with what people can do now.
That's Israel Inspired with Ari and Jeremy on the Land of Israel Network at thelandofisrael.com.